I want to start off by just talking about the emotions that we're all sharing. You're tired. We are too. Everyone is tired of COVID and frustrated and probably even a little bit confused by all of the different information that is out there and some of the changes happening in other jurisdictions. So rightfully so, we understand all those emotions. You've done everything you've been asked, but COVID has proven to be a formidable opponent. The leading scientists around the world have thrown everything they have at COVID. Billions and billions of dollars in research have been put into COVID. Still, I think we can all agree, despite that, COVID is not going anywhere anytime soon. Just since we last met, since our last briefing, the loss of 25 Nova Scotians can be traced to COVID. Those families have my sincere condolences. It's an absolute tragedy, and we're all sorry for your loss. We truly are. But we also know that more Canadians will continue to be lost to COVID going forward, and that's also heartbreaking. But we have to acknowledge the necessity of continuing to move forward. Our current set of restrictions are in place until February 14th. But we're at a stage where Nova Scotia is ready to make gradual changes, and we can make those changes with confidence. Our public health team has been incredible and is incredible. They haven't changed. Dr. Strang hasn't changed. He's the same compassionate, thoughtful, brilliant leader that has led us this far, and he has earned our trust, as has his team. We can have confidence in his guidance. I know I certainly do. So today we will be announcing easing of some restrictions effective February 14th, and we'll also be sharing a plan to continue that easing gradually in phases going forward from there. The reality is that the more we continue to let COVID control our daily lives, the longer we will see the negative impacts, especially on our children and on our seniors. So Dr. Strang will provide more details, but in high level, I guess, effective February 14th, sports, arts, and cultural events can resume. Gathering limits will increase for informal events from 10 to 25. Restaurants and gyms will increase capacity to 75%. Retail can increase capacity back to 100%. Cosmetologists can resume their full services. So all of those things will be effective February 14th, and there will be lots more to say about the moving forward over the coming weeks. We'll have a lot to say about that. But I do want to be very clear about why this is happening, why we are able to ease restrictions, and it's happening because of our high vaccination rates and the fact that we're leading the country in booster doses. These are not things to be ignored. It's also happening because we know the need to balance between restrictions and the risk of COVID in terms of our overall public health. So every step of the way, for 2 years, we have followed the science. And today, and every day, we will continue to be guided by Dr. Strang and the team at Public Health. So as we move forward and Nova Scotians continue to do their part, we also recognize that government has work to do as well. Everything we've done has been to support our healthcare system and make sure that it is there for each of us should we need it for any reason, and that remains the priority today. So we don't have to think too hard to remember the videos of people around the world banging pots and pans on their balconies and on their front doorsteps to show their appreciation and gratitude to our frontline heroes as they rotated through their shift changes. We all remember that. That admiration for our healthcare professionals and frontline professionals cannot change. In those moments, we were together. And we know that to move forward, we have to stay together and work together to take pressure off the system. And that means government has to take some immediate steps to increase healthcare capacity. So I'll say last week, all 13 premiers came together to discuss the state of healthcare in Canada. Everyone is experiencing challenges with their healthcare systems. It's consistent across the country. It is clear that Canada's healthcare system is significantly underfunded. Canada's healthcare system has struggled to meet the needs and treat COVID patients and non-COVID patients at the same time. It's been a struggle. Meeting with the other premiers, I was struck by the comments of one premier who shared a story where a constituent told him, just said quite simply, for 2 years, I've done everything that's been asked. I'm boosted, I'm vaccinated, I've got my kids home, I've done everything. But she asked him, what has the government done to improve capacity in the healthcare system? And I've reflected a lot on that question, as have the other premiers I know from talking to them. But it's clear that we have more to do as a government. So in Nova Scotia, one necessary step to increasing capacity is working with the long-term care sector to open more beds as quickly as possible. The biggest issue that we have in opening more beds in long-term care is that there's not enough workers. So there are people in hospitals that could be, better cared for in long-term care. There's space in long-term care, but they don't have the staff to open those beds. So this is something that we can do. And the fact that they don't have enough staff is happening at the same time that there are hundreds of continuing care assistants in this province who are trained and amazing at what they do, but they aren't working in their chosen field. And I don't blame them. To every Nova Scotian who might not fully understand the important work of a CCA, listen to Bruce Guthrow's song, What Makes a Hero. Watch the video. It's one of the most useful videos on YouTube. It's powerful. And in that song, Bruce says that a hero is someone who does what needs to be done and needs no other reason. They just do it. So to our CCAs, we know the important work you do. And we know that we have work to show that to you. So this week, our government is taking an important step to reiterate the incredibly important role you play in our healthcare system. You've been underpaid by almost every metric possible to look at it. I heard loud and clear last night on a call with hundreds of CCAs, some of the issues that they're facing, and the compensation was a big part of that. So I want them to know that today, we're taking steps to fix that issue. I'm happy to announce that we will be increasing the pay for every CCA in this province, and we will make Nova Scotia a pay leader with the raises that we're putting forward. So it'll work out to approximately 20 to 25% increase for CCAs. We'll work through those details with you, but it is effective tomorrow. So my message to those of you who have felt undervalued to the point that you left the profession, please come back. We need you now more than ever. We want you, we need you, we value you, and we respect you. If we can get people to return to the industry, it will have a incredibly positive impact and help us with our capacity issues. So I know it's not a silver bullet to everything facing healthcare, of course, but it's one tool, and we're going to do it. So that'll be effective immediately. Before I close and pass it to Dr. Strang, I do want to speak about education. The top line is, from everything that I hear, students are happy to be back in school, and that's very good. Yes, we are still seeing somewhere in the range of 20% students absent. But as one teacher said to me, look at the positive. That means 80% of our kids are attending school, and that's what's important. So like healthcare, our schools are functioning, but the systems are stressed. There's no question about that. So I just ask people, parents and family members and caregivers to please bear with the teachers and educators and the staff as they strive to find the balance between student well-being and student achievement. Just as we have had to adjust our expectations for healthcare, like canceling non-emergency surgeries, we need to do that as well for our other systems as we work through this wave. So please be patient, understanding that we are living through the pandemic, that there are pressures on the systems, and they're bound to have an impact. But the one thing we can never lose sight of is the need to focus on student well-being. So I thank those teachers and educators and people working in the schools for doing just that.